Okay.
He's watching too. Hi, I'm Kara Pierce. I'll be your PA student today. Can I get your name and date of birth?
My name is Sarah Brown, and my birthday is 4/13/97.
Okay, great. So what brings you in today?
Abdominal pain.
There you go. Great. Okay, so we're going to do a physical exam. So I'm going to give you this to drape over you and pull your shirt and your pants up. So I'm going to step out real quick and be right back. All right. So we're going to start.
You're supposed to film that, right?
No, but I can edit it out. We'll start our physical exam. So just pulling these down and this up. So I am inspecting the abdomen. I'm looking for any abdominal masses, hernias, anything obvious to the eye, noting color, temperature, any telangiectasia or any vascular abnormalities, looking at the umbilicus, checking for any signs of inflammation, checking the shape of the abdomen, the curvature. All right, so Miss Sarah, I'm gonna start by listening to your abdomen. So I'm just gonna listen at 4 different areas of your stomach, and then I am going to listen at your aorta, some renal arteries right here, and then some iliac arteries. All right. All right, so I'm gonna listen over your liver and over your spleen now as well. All right. All right, so there was no friction rubs over any of the liver or the spleen. There was also normal sounds and vascularities, no bruits, no any sort of vascular hums or anything like that. Bowel sounds were normal active, no any sort of clicking or gurgling, just normal bowel sounds. All right, so now I'm going to percuss. So that's where I'm going to take an abdomen. I'm going to place my hand and just hit the top of it and listen for the different sounds. All right, so here we go. All right, so percussion sounded normal, tympany and dullness located in the correct regions with dullness over any sort of organs and tympany over most of the abdomen. So now what I'm going to do is I'm going to do some light palpation. So I'm going to do that again in the 4 different areas. You're just going to let me know if you feel any sort of tightness or any sort of pain while I'm doing this, okay?
Okay.
All right. All right, so no pain or anything like that?
No.
Okay, so now I am going to do some deep palpation. So I'm going to press a little bit deeper, and again, just let me know if you feel any associated pain. All right, so palpation was normal, no any sort of masses or enlargement noted to begin with the palpation. No rigidity, no guarding, was normal, healthy abdomen. So now what I'm gonna do is I'm going to start with your liver, and I am going to percuss to find the borders of it. So again, the same little exam that we were doing before. And then starting here. All right, so normal liver span, nothing appreciable there, was very good. So now I'm gonna palpate. So I'm gonna have you just lay relaxed on the table. I'm gonna have you breathe in and out while I, again, just do some deep palpation and it's for your liver. Okay, ready to take a deep breath in and out. Okay, one more time. Okay, so while I'm here, I'm just going to change my grip a little bit. We're gonna look for any sort of gallbladder tenderness. So take a deep breath. Okay, and out. Good. All right, so now I'm going to assess for any sort of spleen enlargement with percussion. All right, spleen percussion was normal. So I'm just gonna reach my hand around to this side and I'm going to place my hand here and I'm gonna press in. So go ahead and take a deep breath in for me. Okay, and out. Any pain, any tenderness? No. Okay. Normal spleen. All right, so I'm gonna go ahead and have you roll over to your right side for me. Great. And we're just gonna do that same thing again, but with in this direction. All right, so go ahead and take a deep breath in and out. All right, good. Okay, one more time. Okay, good, that was normal. So you can go ahead and lay back to your back again. So now the next thing that we're gonna do is I'm gonna feel for your aorta, just noticing no pulsing or abnormal movements of the abdomen from the surface. So I'm gonna go ahead and palpate for the aorta. All right. All right, aorta was normal, so that's less than 3 centimeters, no significant finding. Was there any pain with that at all?
No.
No pain, okay, great. So now what I'm gonna do is I'm gonna assess for peritonitis. So what I'm gonna do is, we already checked your we already felt your 4 quadrants. There was no guarding, no rigidity. But now what I'm gonna have you do, I'm gonna have you cough, and just let me know if you feel any pain with the contraction of your abdominal muscles. Okay, did you notice any pain or anything like that? No?
No.
Okay, good. Now I am going to check for some rebound tenderness. So I would typically do this in the area where the patient was feeling pain, but this was a normal abdominal exam, so I'll demonstrate here. So I'm gonna press down. Okay, and then let me know whether it's worse when I press in, when I let go, or if you feel any radiation. Okay, ready? Is it better or worse when I push in or when I push out? The same. Okay, great. And then what I'm gonna do is I'm gonna check for percussion tenderness. So similar like the other one, I'm gonna place my hand here and just hit it, and then gently, and let me know if you feel any pain, okay? Any pain or anything like that? No. Okay, good. So now what I'm gonna do is I'm gonna check for appendicitis. So I'm gonna have you lay your legs out straight for me. Great, okay. So we already checked McBurney's point, no tenderness, no pain here on our deep palpation. So what I'm gonna do is I'm gonna again press down in this area and let go. Let me know if it hurts worse when I'm pressing in, when I let go, or if it radiates anywhere. All right, ready? Normal, nothing, okay, good. So now what I'm gonna do is I'm gonna come down here to your right leg. I'm gonna place my hand on your knee, and you're gonna press up against my pressure on your knee. Ready? Okay, good. You can relax your leg. Any pain with that? No? Okay, so what we'll do is we can, we'll lift your leg up. You can rest it in my hand. So what I'm gonna do is I'm gonna rotate your knee in while rotating your ankle slightly out. Let me know if there's any pain. Any pain? No? Okay, good. So all exams for appendicitis were negative. So now what we're gonna do is check for any pain with the gallbladder. We already checked here. She had no pain, no Murphy sign in the upper right quadrant. So that was our normal abdominal exam. No complaints, doing good?
No.
Great. Awesome. Okay, we're done.